Okay, welcome to the K Vision podcast. This is our key podcast to listen to if you want to be energized, motivated, and inspired. We are here to sprinkle your life and your career in ophthalmology with positivity and a little bit of a spice as well for the winter months here. So we have a very special guest. This is our season 1, episode 4. We are entitling this talk as Women as Innovators. And we have a special guest all the way from India who needs little introduction, if at all, Dr. Soosan Jacobs from Dr. Agarwal's Eye Hospital. So thank you, Soosan, for accepting our invitation to come on the podcast. How are you today?
Thank you so much, Tina. It's an honor and it's a pleasure. Thank you for inviting me here. I'm fine. I think, a nice time of the year, Christmas being just around the corner, and it's really great to be doing this podcast with you.
Excellent. We always start by giving our listeners a little bit of a funny story or a pivotal story in your life, which really was a learning opportunity for you as an innovator and as a leader in your field. Can you think of any stories that you can relate to us and tell us?
Well, I think, yeah. Well, if I really think about it, I think one change, a pivotal kind of change that I felt that happened in my career was I used to do a lot of oculoplasty also earlier, oculoplasty in orbit and stuff like that. And so I was having to operate this child with ptosis, with poor levator action, and so it was basically a frontalis sling that I had to do. And I was going to do this, and there was this beautiful young boy, standing there, small child actually standing there. And I was going to be putting these big scars on his forehead, and basically he had droopy eyes. I would be solving that, but then I would be replacing that cosmetic problem with big scars on his forehead. And I was really thinking this is really not a nice way to do it. But up until then, I was, just typically following textbooks, doing surgical step by step by step by step. And then I was thinking to myself, why this way? It's really not such an apt replacement, of, you're basically spoiling his cosmesis all over again. And so while I was thinking to that, there's suddenly this moment of somehow some sort of clarity, which kind of told me, why would you want to bring the needle out from over the brow when you can just go underneath the skin, turn the angle, and just bring it out through a central, very small, tiny incision instead of putting these incisions also.
Yeah.
So I did that, and it worked beautifully. And the child had just one small scar in the center. So instead of 3 + 3 = 6, he had just two, and he was cosmetically very good. And that was my key moment actually, when I thought that you don't necessarily have to do what the textbook says, but
Yeah.
you can actually change and innovate and kind of think in a different way, and you might still get great results. And that kind of made me start thinking that textbooks are not the final say, because
Yeah.
textbooks have been written by people like us,
Yeah.
who have also come
Exactly.
through this path. And it's always been an evolving path. There's never
Yeah.
been there's never a final say on something. You innovate, and you stand on the shoulders of giants who have there before you, and then you see a little further, like that. And so that's what really made me think that I maybe there's more to it.
Yeah.
In addition to that, I come from Agarwal's Eye Hospital, which has a history of innovation in with Dr. Amar Agarwal, who's been a mentor to me, who's always had the spirit of innovation. And so of course always nice to be working in an institute like that.
Amazing, amazing. So, can you think of any big letdown or a failure in your life that really made you stand out and think, I need to do things in a different way? And how did you deal with failure?
Well, okay. So, it actually kind of well, if you talk about failures, want to kind of changing the way you practice. There are
Yeah.
lots of it's always generally a failure that is a stepping stone to success, right?
Yeah.
You can never progress or think further if everything you do is going to be great and successful. Then you're very happy and content with where you are. Everything's perfect, right?
Yeah.
There's no need to change anything. So I
Yeah.
think failure is definitely a very important part of
Of
your
course.
overall development and the development of your field, because unless you have failures, you're never going to think of, what do you do next to overcome this failure. So of course there have been a lot of failures in everything, failure with, for example, cares, failure with the way we do surgery with synthetic segments was the reason why I started thinking, what, these patients are coming back with melt, so what's the answer? That's not a great success. So
Mm,
that kind of makes me think, what is next. I was doing for instance, another example is PDEC, pre-Descemet's endothelial keratoplasty.
yeah.
And the graft was difficult to handle when I first started out. So that was again a type of failure, because if you're not able to handle the graft within the anterior chamber well enough to make it easy, then what do you do next? And that's when I thought of the air pump assisted PDEC technique, where I've got a third hand which is supporting me, the air basically, which is being infused into the anterior chamber, and
Yeah.
that's supporting the graft and acting as a third hand, and that completely changed the way the surgery could be done. So I think failures are a great part of your life. It's really
Yeah.
essential to have failures so that you can move on from there, and the movement should is generally forward if you are positive thinking. The
Yeah.
thing about failure is, don't get disheartened by it. It happens to everyone,
Yeah.
everyone, the best of people, it happens.
Exactly.
And exactly, yeah.
All the successful people you hear about, that celebrate their success, but you don't really celebrate their failure, which may have been many in between their successes. And that's the way to grow, isn't it, for everyone?
Absolutely, absolutely. Unless you have failures, you're never going to move forwards, because you'll be so content where you are.
Yeah. And in your team, how do you foster that, that positivity and the growth and learning from your failures and moving on, and as you say?
So, as I said, I think, where I work, the environment is very, very pro innovation.
Yeah.
Dr. Agarwal's Eye Hospital, Chennai, it's very pro innovation. It's very, it lets you think freely. You have the freedom to kind of talk out new things with each other, discuss with each other, yeah, kind of, help each other, egg each other forwards,
Yeah.
look at failures of each person, and not kind of immediately say, hey, that's failed, why are you doing this? There's no point of doing it, but rather say, okay, it failed, so why did it fail? Let's analyze that,
Yeah.
and let's see how we can prevent it from failing the next time we do it. So I
Yeah.
think those are things that are crucial, and a lot of it depends on your environment, the people you work with, your colleagues, your whole team. It's not just your superiors, but also your colleagues, your juniors, your fellows, your nurses, your staff. Everyone actually plays a role, and of course the patients, because patients trust you, and that's a great thing to have, to be able to have patients who trust you and who know. Many times I tell them, look, we're going to try this out, and I don't know, I can't tell you for sure if it'll work,
Yeah.
but I think it's going to cause you damage, so we can try this out and see what
Yeah.
happens, and if you're not happy with it, we'll do something about it.
Yeah. So it's having that positive attitude, is that's important, and analyzing without misplacing negativity. I think that's what you're
That
trying to
that
say.
is
Yeah.
key. That is key. Having a positive environment and also keeping things positive for everyone always makes the team move forwards.
Yeah.
Otherwise you're always just getting pulled back, and that's
Exactly.
not good for everyone.
Exactly. And now we talk about your proudest achievement. I think CARES is one of your proudest achievement, but you tell us, Susan.
Well, I think my proudest achievements would be my children.
Oh, yeah, yeah, yeah. Of course. Yeah. Outside of work, that's the main thing. Yeah.
In my personal life, yeah, I have a son and a daughter, and they're two wonderful children.
Oh,
And they're both in college doing very well. So
yeah,
that is basically my proudest achievement. And then if you come to my professional life, I think yes has been a good kind of thing that came about in my life, which I worked on more and more, and we've got to develop to a stage where we are at right now. That's
yeah,
definitely a great thing, because it's also been taken up very much worldwide.
yeah,
I have done a lot of other innovations, of course, previously,
yeah.
in terms of devices, techniques, and things like that. But
Mm,
none of them actually became as popular as CARES, I would say, though many of them are being done around the world by many people. But
yeah,
CARES was just that thing which, what should I say, which was very easy to access by all surgeons, did not need a long, for example, air pump PDEC, my innovations in terms of PDEC or anterior segment surgery, iris repair, and all these things,
yeah,
even though they're great techniques, but there's a lot of learning skill
Yeah.
required there. The learning curve is long. DALC, for example, I've done acute high drops, primary pre-dysemetic DALC in acute high drops. Now there's a learning curve to that. So
Yeah.
it's not something every surgeon would just want to take up and do. But
Okay.
CARES was something that had a very easy learning curve. It was almost like doing refractive surgery. You do LASIK, for example, has an easy learning curve. So
Yeah.
CARES had an easy learning curve, and it had great results. The eye banks were able to offer it to the patients. So all in all, it was kind of a very positive thing for surgeons, for patients, for eye banks, and for everyone who's involved in it. It was something that was easily accessible to femtosecond technology, and all of those things I think kind of came together and made it a big success.
Yeah, lots of different parts came together, and it just really taken off, hasn't it, Kez? And
Yeah.
what's new in that field? Are you thinking of customizing it more, or is there more to come on that field for Kez?
Yeah, I think cares, of course, is extremely an evolving field. We are doing now custom shaped cares, which is basically not just customizing in terms of the shape and I mean, not just customizing in terms of the length or the placement of the cares, but also actually customizing the shape to each individual patient. Now, Trina, when you look at a keratoconic patient, or when you look at two different keratoconic patients, you have all these different phenotypes, croissant, snowman, and all these things. But these
Yeah,
are broad phenotypes. But even within the croissant or even within the snowman, if you look, there's a lot of variation between different patients, even within the same phenotype. You cannot just do the same. For example, say symmetric segments, asymmetric segments with the synthetic segments, which are also available with Intax, and not with Intax, but with certain other companies. The asymmetric segments are available. But
yeah,
because it has to be made in a factory, they're kind of preset, right? You
yeah,
have a fixed length, you
yeah,
have a fixed gradation
yeah,
of the thickness or the width, and you have a fixed optic zone. Everything is fixed about it. Now,
yeah,
how can you put fixed segment for two different patients just because they fall under the same phenotype? They're completely different patients,
they
right?
are.
It's like, that we both are women, so everything should be same about us.
Yeah,
you know
exactly. Yeah.
Men are different and women are different, but as within women we are exactly similar. It doesn't work like that at all.
No, it has
So
to be individualized, isn't it?
absolutely, it has to be completely individualized, which is why where CARES has got a huge advantage, because it's allogenic tissue. You can immediately do it, and that's what we've been doing now since 2018. Actually, custom shapes, and we're getting better and better at it. I've got my own nomogram now,
Yeah.
which is actually giving us a lot of success. I'm also teaming up eye banks now, where, for example, the Lions World Vision Institute, where you can actually order, you can send your topography to them, and
Okay.
excuse me, it'll be customized for you, and then it'll be sent back to you, so that
Okay.
it's just ready for insertion in a customized manner, made
I
specifically for that patient.
oh, that's going to take it to that different level, isn't it, with your own nomogram? Is
Right.
that based on more
Absolutely.
than 500,
Ab-
or how many patients would you say came together for the norm?
oh, we've got about 1,000 patients now
Amazing.
with
Yeah.
cares in our center, which is our main center alone. But of course, Agarwal has about 217 centers. Many of them are doing care, so the total number is more.
Wow.
The other thing that's going to be new in cares is, of course, femtosecond technology is there for some time now, but also the manual segment preparation is also extremely easy, because you can just immediately cut it. It's like drawing, when you draw, you can immediately take a pencil and draw, right, the way you want to. So because of the cares customizer instrument, you can actually just mark it and immediately cut it. And the Strifine, which was still till now not available in the European market because of CE marking, this
Yeah.
January on New Year onwards, it's going to become available in the European market as well, because it's going to be CE approved and available. So the European surgeons can also start using that and customizing right there at your own center. That's also possible.
Do you think running those, I think you've done a wet lab of the cares, is that going to help, other surgeons take up the cares even
Absolutely.
readily? Yeah.
Yeah, absolutely. I think CAS is one of those surgeries, as we just mentioned, where if you do a couple of wet labs,
Yeah.
it becomes very easy to just to go back home and just start off immediately, because
Yeah.
most of it is just going to depend on the, on the planning, and the actual surgery per se is pretty simple. There's just a few simple concepts that you need to learn, and it makes it very, very simple. So wet labs is great. And my advice is, even if you don't are not able to attend a wet lab because you're not traveling or something like that, just go online and watch a few videos. That's also a very, very, very useful way to just learn
Yeah.
surgery.
Yeah, amazing. I've been trialing it on wet lab and really excited to start using your Trefine. That's amazing. So let's come back to your unique selling point. What would you describe your unique selling point to be?
Well, that's a tough question, Tina.
For
Okay, these
your
are really tough you're asking me. All right. USP for me, I don't know. You tell me, Gina. What do you think my USP is?
For me, I would describe your innovative spirit and your positivity as your unique selling point, but you can elaborate on that.
Well, I think that is kind of true. Innovation, kind of, I love it. I just love thinking of something new, different. Like kind of, when I see something, I like to think of it from a different angle. I don't like to kind of just look at it at the same angle all the time. So I see a problem, and then I'm kind of thinking, okay, now what? What next? What do you do next?
Yeah,
So that is something that kind of is always running in the back of my mind. So I think that's possibly right what you said about me. I
yeah,
also enjoy doing academic work, academic articles. It's
yeah,
uh, what I would say is, ophthalmology for many of us, and as I'm sure for you, is more of a passion than a job. So I love doing ophthalmology, the field of ophthalmology. It's
yeah,
just it's just so exciting because of multiple reasons. One, it's very delicate, very fine surgery.
yeah,
You can see the post-operative results right in front of you. Where else can you do that? You have an abdominal surgery, you've done it, you've sutured up everything, and the next day you're wondering what's happening. I have no idea what's going on inside that abdomen. Whereas we can look at the post-operative field exactly as we left it on slit lamp, on the fundus photograph, through you've got all clear visualizing fields. So you know exactly how things have moved from where you left it on the theater, on
mm,
the operating theater. You've got
that,
physics involved, you've got lasers involved, you've got high-tech stuff involved, you've got basic stuff involved, you've
yeah,
got the beauty of a person actually being able to see. I mean, where else can you get this kind of thing? So I think that's one thing that I love, that I love my field.
yeah,
It's like a passion, like a hobby, and I think that's a blessing,
yeah.
because if your work is like a hobby, then I mean that's great. That's a blessing.
Exactly. If it's your passion and it's like your hobby, then it doesn't feel like work. And then you
Yeah.
can really grow and grow for the benefit of your patient. And it just makes you happier because you get that immediate feedback from the patient, how happy they are for what little skills that you've used to make their vision that much clearer. So if I can ask you, what is your leadership skill within your team? How would you describe your leadership skills to be? Um,
Well, I would say my leadership skill is very laid back. Okay, I am not someone who's very pushy or who keeps, demanding things to be done. I'm pretty laid back. In fact, I kind of give my immediate juniors complete freedom to do what they want, and in the manner that they want. I give them a very free hand. I do like certain basic stuff to be followed, which means that you don't go completely uh, off track in an abnormal manner, but
yeah,
within scientific principles, basic scientific principles, there's a lot of freedom given in terms of how they work, which way they work, and things like that, which I think keeps the whole team happy, because nobody likes to be under a person who's all do this, do that, and all that. And I frankly think there's really no need for that, because when you start doing that, you are actually starting to micromanage. The person who's being micromanaged does not like it, and you end up losing your valuable time doing micromanagement when you can utilize it for something that is much better. And
exactly.
nobody wins in the whole process.
I know nobody's happy. So
Nobody's
how do you manage conflict? So if there's conflict in your team, how do you manage that?
ah I don't like conflict, number one.
Yeah,
So I kind of go, either talk to the person and kind of thresh it out, saying, okay, so this is what happened, so what do you think about it? Do you think we can do it in a different way? What's your opinion? Do you think, give me a couple of options, the way you would manage it or way you would like to manage it, and let's see how that goes. And if they say something that doesn't make any sense at all, then I might point out the advantages and the disadvantages to them, and
yeah,
say, okay, you do. And then finally I say, look, these are the things that I feel, but then you think over it and let me know what you feel about it. And I, give them some time. Basically, there's
yeah,
no need to reach a decision right at that point, because you need to let the person kind of go home, think about what you said,
yeah.
and then come back. I think it's always nice to come back a second time, to
Fresh, yeah,
give all sides time to think over, because right then you're really not thinking completely clearly. So give
yeah,
people some time to think. End on a positive note.
yeah,
Don't end on a kind of what should I say, on a aggressive note. End on
yeah.
a very positive note, that there's always a way to come to a resolution, and we'll do this in a way that's positive for everyone involved.
That's true, because in the heat of the moment you have all the emotions. So if you have a little bit of break,
Right.
then people can come back with all their
Absolutely.
faculty in use. Yeah.
Yeah.
Um,
Yeah,
so
absolutely.
if you
I think also that's a very feminine way of doing it. I'm sure I'm not the only person, I'm sure these are things that women I think are very good at in general
yeah.
because we this is kind of ingrained in us. So I think this is just something that all women have in them.
I know we walk away from really heated situation, come back and resolve it again.
Right.
That's true. If you had to give your younger self three top tips, what would it be? So, say in your 20s and 30s, someone beginning.
Mm-hmm. I would say, um, I would probably say delegate more, which I
Mm,
still don't. I'm a bit of a perfectionist, so I like to kind of, as far as my academic work is concerned, I would say I like to kind of do it myself. I think you must be also knowing that about me,
yeah,
that I kind of like sit and do. So that is one thing which I think I should kind of learn to delegate out more, and that's one thing I would say.
yeah,
Second thing I would say is probably maybe make ophthalmology a little bit of a less of a hobby and get more hobbies, which I think I have succeeded a little bit in recent times because
yeah.
we've got two great additions in the form of two dogs in our family,
Oh,
and we all have wonderful time playing with them. My daughter loves them,
yeah.
and go for walks and things like that. So I think that's
What kind
that's
of
good.
dogs are they? What kind of
Oh,
dogs?
we've got a Beagle and we've got a Golden Retriever, and
Oh, that's lovely.
always open to the idea of more dogs as well because I think we've all fallen in love with them.
I
So
know.
that's number two, and tip number three, I think would be kind of I don't know I don't know what a tip number three would be, but I think I would kind of I think a tip number three is to believe in God. That never feel down, never feel kind of there are times in your life when you might think that why that things are looking black or dark, but it always changes. It's always a cycle. The cycles always go on and on, so there's always light at the end of the tunnel. You'll always,
Yeah,
be it a problem that you're dealing with in ophthalmology, be it something that's professional, personal, whatever, it
yeah,
always, the cycle always completes. So even if you're at a lower point, you'll always, and so don't feel, kind of keep yourself resolute and resilient. I think resilience is important.
yeah.
That's very, very important.
That's
Those are the things I would say.
that's really interesting point. That change is constant. So if you're on the up, there's always going to be a down, and there'll be an up
Right.
coming up. So just
Absolutely. Absolutely. And remember that this is there for everyone. Everyone. This is there for every single person in the world.
yeah,
Nobody has up, 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 and it keeps going up. It's
yeah,
never there. You might see this in, social media or Facebook or whatever, but it's never like that for everyone. So, I
yeah.
mean, you're not the only person in the world who's having a tough time or whatever. Everybody is in their own ways.
Yeah, everyone's journey is different, but they're all going through up and down like you. Exactly.
Absolutely. So the thing is to always keep positive and know that whatever the tough times are will come to an end and work towards it. Just keep working towards that.
That's it. So just to end on the note, now in your field of ophthalmology, if there's one thing you could change, what would that be?
Oh my God, these are really tough questions, Tina. Okay, thing to change in ophthalmology. All right. I don't know. As I said, I think ophthalmology is a very, very beautiful field. I think it's a perfect field. I would say maybe the thing to change would be a little bit of better education and surgical experience for younger ophthalmologists,
Mm-hmm.
because that is something that is very difficult, and it's understandably difficult because the number of surgeries is limited and things like that. But
Yeah,
I think that's also actually being addressed very well now with all the the models that are there, the surgical models, simulators, and all these haptic transmission machines and all these things which are coming, which are actually making it much more easier for the younger ophthalmologists to learn. The other thing I think would be very important is not to forget certain techniques, which is now again coming back to the front, thankfully, like EC extra caps and manual small incision cataract surgeries, because I see many young ophthalmologists who are fabulous at doing a phaco, but then when you had in a problem and you have to convert to extra cap, then it's a little difficult. So I think basically ophthalmology is a pretty good field. I think we are heading the way it should because it's keeping on getting better and better. And I think basically all ophthalmologists around the world are reasonably working towards a common goal of making our patients see better and better.
Exactly.
What can be improved is surgical training for young ophthalmologists. I think that is crucial because they're the next generation. They're the ones who have to go forwards, and
Yeah,
that is crucial. And
exactly.
they're very
They'll be
comfortable.
operating on our eyes. We want to make sure they're trained well.
Right, right.
And
But they
that's
are a
where
smart generation.
wet
They're very
lab
smart.
stimulation comes in, which is a passion of both of us. Yeah.
Right. But it's brilliant. It's really nice to see the young ophthalmologists because they're brilliant. They're very smart. They're very focused and dedicated. So I'm pretty sure they're going to be absolutely fine. It's and probably this is exactly what our seniors would have said about us. All
Yes.
right.
Yeah.
And this is the cycle of life. This just keeps going on and on. We keep worrying about the younger people, but they do so beautifully anyway.
Yeah. Well, thank you. That's been absolutely inspiring listening to your journey. And I'm always energized talking to you. So thank you for accepting this invitation. And if there's anything you want to say to our audience or last messages that you want to give, that would be excellent. Thank you, Soosan.
Thank you, Tina. I think the last message that I would like to give is your field is lovely. Congratulations for being in ophthalmology. Just keep rocking, keep doing whatever you're doing. Stay focused and stay positive.
Thank you very much. Have a lovely Christmas and New Year.
See you too, Tina. Bye bye.